So next topic is direct vasodilators. So what it will do means they will directly act upon the arteries or the veins. So in the heart there will be the arteries on the veins. So right, so it is used to reduce the blood pressure. Means they directly act upon the arteries or the veins to reduce the blood pressure. So in this, first one is atrial vasodilators. See here, the Diaxoxide, Minoxidil and Hydralazine or the potassium channel openers used in the antihypertensive agents. Means these are the three drugs which comes under the potassium channel openers and also the atrial vasodilators to reduce the blood pressure. So they cause direct relaxation of the arteries, means it is used in the relaxation of the arteries only, but it does not act on the veins. So however, this usage as a single dose is discouraged, means the single dosage form is not proposed to use. This drug should be used in the combination form, because the relaxation of the blood pressure by the relaxation of the smooth muscle is opposed by the sympathetic activity. Release of the adrenaline, means this drug should not use the single dosage form. It should use in the combination of the other drugs in order to inhibit the release of the adrenaline. Means here the adrenaline is responsible for the vasoconstriction. Vasoconstriction means the constriction of the blood vessels in the heart. So if the blood vessels in the heart undergoes the constriction, means there will be increase in the pressure for the heart. So if the pressure increases, means the blood pressure is also increases. So in order to avoid the blood pressure, the combination form of the drug should be used in order to inhibit the adrenaline release. So in order to stop the vasoconstriction, so it leads to relaxation of the blood pressure by relaxation of the smooth muscles. So if the smooth muscles get relaxed, means the blood pressure is also reduced. So in this first drug is diazoxide. See, this is the structure of the diazoxide. IUPAC name is 7-chloro 3-methyl benzodiazine 1,1 dioxide. See, this is the structure of the benzodiazine. See here, this is the benzene. Thia means a sulfur. Azine means nitrogen. Two nitrogen atoms are there. So it is named as diazine. So two nitrogens are means diazine. So commonly known as benzo, diazine. So for the benzothiadiazine, in the 7th position the chlorine atom is there. See here, in the 7th position chlorine atom, and 3rd position methyl group, and in 1st position 2 oxygen atoms. So it is called dioxide. See here, 7-chloro 3-methyl 1-benzothiadiazine 1,1 dioxide. So properties are, it is a white or almost white crystalline powder, and it is soluble in the dilute solution of alkali hydroxide, dimethyl formamide, and soluble in alcohol but insoluble in water. Next, pharmacokinetics. It is well observed on oral and parenteral route of administration. Means this drug should be given in the both oral route and parenteral route of administration, and it is highly bonded to the plasma proteins, and it undergoes the hepatic metabolism. Means the metabolism undergoes in the liver and it is excreted through renal route. Means it undergoes the renal excretion. So adverse drug reactions are tachycardia, hypotension, fluid retention, hyperglycemia, hyperuricemia, means abnormal increase of the uric acid in the blood. So if the uric acid also increases in the blood, is also danger. And Angina, myocardial infarction occurs in patients with ischemic heart disease, nausea, vomiting, stomach pain, loss of appetite, diarrhea, constipation, or decreased sense of taste. Next uses, it is used in the treatment of the hypertension, means it is used to reduce the hypertension, and it is used to arrest a premature labor, and it is used for temporary treatment of hyperglycemia secondary to insulinoma in insulin producing tumors for the beta cells of the pancreatic isolates. Means it is used in reduce the blood pressure, and also it is used to reduce the premature labor, means pain in the pregnancy ladies, and also it is used in the treatment of the hyperglycemia. So dose 150 mg by rapid intravenous injection. So next drug is minoxidil. See here, minoxidil. So this is the structure of the minoxidil, and IUPAC name is 6-pyridine pyrimidine 2,4 diamine 3 oxide. See here, this is the structure of the pyrimidine. 2 nitrogen atoms for 6 membered ring. So it is a pyrimidine. In the second and the fourth position, amine structure is there. So it is, how many are there? 2. So it is diamine. So 2,4 position amine group is there. So it is diamine, and here in the 6th position the piperidine is there. See here in the 6th position the piperidine is there. So this is the pyrimidine structure, 2,4 diamine, and here 6 piperidine 3 oxide. So properties are, it is a white or almost white crystalline powder, and it is slightly soluble in water, soluble in methanol and propylene glycol. Next, pharmacokinetics. It is well observed from the gastrointestinal tract on oral route of administration. So this drug should be taken through the oral route of administration for the well observed gastrointestinal tract, and it is converted to the active metabolite in the liver by conjugation process, and it is excreted through urine. Next, adverse drug reactions are headache, fluid retention, palpitation means the irregular heartbeat, means heartbeat may raises or heartbeat may falls, and angina, pulmonary hypertension, cardiac tamponade and tachycardia, and excessive hair growth. Hypertrichosis means excessive hair growth on the body. Next, therapeutic uses. It is used in the treatment of the hypertension, and this drug should be given in combination with beta blockers and diuretics. So this drug should be taken in combination with beta blockers drugs and diuretics for the treatment of the hypertension, and also it is used in the treatment of the alopecia. Alopecia means bald headedness, for the hair growth. Means the person, those who have the bald head, for the treatment for to grow the hair on the head, for that purpose also the minoxidil drug is used. So dose 1.5 mg, we can gradually increases to 40 mg by oral route. Next, hydralazine hydrochloride. See here, drug name hydralazine hydrochloride. So this is a structure, and IUPAC name is 1-hydrazinyl 1-hydrazinyl thalazine hydrochloride. IUPAC name is 1-hydrazinyl thalazine hydrochloride. See here, in the first position the hydrazine structure is there, and this is the hydrochloride, and this is the thalazine structure. 8 members are there. See here thalazine structure. In the first position the hydrazine is attached, and here this is the hydrochloric acid. And properties are, it is a white or almost white crystalline powder, and it is slightly soluble in methylene chloride and soluble in water and slightly soluble in alcohol. Next, pharmacokinetics. It is oral route of administration for the better absorption in the gastrointestinal tract, and it is metabolized in the liver by acetylation, and it is excreted through the urine in the unchanged form. Means it is oral route of administration for the better absorption in the gastrointestinal tract, and it is metabolized in the liver by acylation, and it is excreted through the urine in unchanged form. Adverse drug reactions are headache, nausea, vomitings, dizziness, anorexia, diarrhea, nasal congestion, fever, rashes, palpitation, polyuretharies, tachycardia, angina, and loss of appetite, weight loss, and chest pain. Next, it is used in uses. So it is used in the treatment of the hypertension, which is not controlled by the diuretics or the beta blockers. So the hypertension which is not controlled by the diuretics or the beta blockers, in such case this drug is used, and it is preferred drug in the hypertension emergencies in the pregnant women. Means the in case of the pregnancy women, if the blood pressure raises suddenly, so for that purpose emergency conditions we can use this drug. It is always given in combination with diuretics or beta blockers. So this drug should not be given in the single form. It should be given with the combination of diuretics and beta blockers, and it is used in the management of the CHF, means congestive heart failure, in combination with nitrates. So next dose 25 to 50 mg oral we should take. Next, atrioventricular vasodilators. In this drug is sodium nitroprusside. So this is the structure of the sodium nitroprusside. IUPAC name is sodium pentacyanonitrosyl ferrate. See here in the present ferrate is present with the ferrate surroundings 1, 2, 3, 4, 5. 5 cyanates are there, and one nitro group is there. And here sodium. See here in middle the ferrate, and the remaining is surrounded by 1, 2, 3, 4, 5. 5 cyano means pentacyano, and this is the nitrosol, and this is the sodium. And properties are, it is a reddish brown color powder, or the crystal. It is maybe in the powder form or the crystal form, and which are freely soluble in water and slightly soluble in alcohol. Next, pharmacokinetics. It is an intravenous route of administration, and it is metabolized in the liver. So if it is metabolized in the liver, what will happen means sodium nitroprusside is converted to cyanide and nitric oxide by red blood cells in the blood vessels. So it will divide the cyanide and nitric oxide by the red blood cells in the blood vessels. So here see the cyanide is very toxic to our body, right? So it will cause harmful to the body. So it is metabolized in the liver to reduce its toxic level, and finally it is eliminated through the urine. Means it is the intravenous route of administration, and it is metabolized in the liver. So this drug is converted into the cyanide and nitric oxide by uh, red blood cells in the blood vessels, and the cyanide is toxic to our body, so it has to be removed from our body. So it is converted to the less toxic, and finally it is excreted through urine. Adverse drug reactions are headache, nausea, vomitings, convulsions, psychosis, dizziness, hypertension, hypothyroidism, abdominal pain, sweating, muscle twisting, palpitations, restlessness, and chest discomfort, and slow heart rate, slow or fast heart rate, flushing, skin rashes, irritation at the site of injections. Means this drug is taken through the intravenous route of administration. So it should be at the site of injection we will feel the irritation or the skin rashes. So uses, it is used in the treatment of the hypertension, means used to reduce the blood pressure, and also it is used to it produces a control hypertension at the time of surgery, means during the surgery time also it is used to control the blood pressure, and also it is used in the treatment of the acute myocardial infarction, means it is used in the treatment of the hypertension to reduce the blood pressure, and also it is used to control the blood pressure during the surgery time, and also it is used in the treatment of the acute myocardial infarction. And those 500 mg powder should be dissolved in the 500 ml of dextrose in water and administered through the intravenous route of administration. So next, adrenergic neuron blocking agent. Here, what it will do means the drug will inhibit the functioning of the sympathetic nervous system by acting on the post-ganglionic adrenergic nerve ending. So mainly it will act on the nervous system. So it will mainly act on the nervous system by to reduce the blood pressure. So in this first drug is Reserpine. Drug name is Reserpine. This is the structure of the Reserpine. IUPAC name is methyl 11, 17 dimethoxy 18, 3, 4, 5 trimethoxy benzenoyl oxy 1, 4 diazep, diazapentocyclohexanica 16 carboxylate. So if we see her structure, 1, 2, 3, 4, 5. 5-membered ring are there. So to this 5-membered ring, here the methyl group is there, CH3 methyl, and here in the 11th position and in the 7th position the methoxy group is there. So how many methoxy groups are there? 2. So it is dimethoxy. In 18th position the 3, 4, 5 trimethoxy benzoyl oxy is present, and in the first position and in the fourth position diaza means nitrogen. 2 nitrogens are there in first and the fourth position. So it is 1, 4 diaza, 1, 2, 3, 4, 5. 5 cyclics are there. So it is pentacyclo 16 carboxylate. See here, 1, 2, 3, 4, 5. 5-membered ring. So here methyl and 11, 17 dimethoxy. In 11th position, 17th position methoxy groups are there. 2 methoxy groups. So it is 11, 17 dimethoxy. 18, 3, 4, 5 trimethoxy benzoyl oxy, and 1, 4 diazap 1, 2, 3, 4, 5 pentacyclo 16 carboxylate. See here methyl 11, 17 dimethoxy 18, 3, 4, 5 trimethoxy benzoyl oxy 1, 4 diazapentacyclohexanica 16 carboxylate. And properties are, it is a white or cream to slide yellow crystals, and it is a crystalline powder, bitter in taste, freely soluble in chloroform, methylene chloride, and glacial acidic. So it is freely soluble in chloroform and methylene chloride, glacial acidic, and it is soluble in benzene, ethyl acetate, and slightly soluble in acetone, methanol, and alcohol, ether, and citric acids. Next, it is oral route and parenteral route of administration. The drug is metabolized and it is excreted through the urine. So here two routes, that is oral and the parental route of administration, and it is metabolized in the liver and eliminated through urine. And adverse drug reactions are diarrhea, gastrointestinal cramps, increased gastric acid, and excessive salivation, and nasal congestion, feeling of the sedatives, nightmares, mental depression, and impotence in males, reduction in fertility in the females, and Parkinsonism and thrombocytopenia. Next uses, it is used in the treatment of the hypertension, means it is used to reduce the blood pressure, and this drug should be taken in combination with diuretics. But due to it has an effect on the central nervous system. So this drug has been declined. Dose 0.25 mg by oral route we have to take. Next, guanethidine monosulfate. See here, guanethidine monosulfate. This is the structure of the guanethidine. See here, IUPAC name 3,2-azokane ethyl guanidine sulfate. See here, this is the 8-membered ring structure. 1, 2, 3, 4, 5, 6, 7, 8. 8-membered ring structure. Here nitrogen is there. This name is azokane. In azokane, 1 vial means here in the first position it is attached to the ethyl group. See here 1, 2. 2 carbon atoms means it is the ethyl, and here 1, this is the structure of the guanidine, and this is the sulfate. So this is the structure of the guanidine. At the third position, the ethyl is there. 1, 2. 2 carbon atoms means ethyl. So here in the second position, the azokane is present. This is a sulfate. So properties are white crystalline powder. It is a characteristic odor. It is soluble in water, slightly soluble in alcohol, insoluble in chloroform and ether. Next, it is an oral route of administration, and it is metabolized in the liver. So guanethidine is converted by the liver into 3 metabolites, and which is excreted through urine. So the metabolites are less active than the parent compound, which are excreted in the urine. Means it is oral route of administration, and it is metabolized in the liver to 3 metabolites, which is excreted in the urine. So the converted metabolites are less active when we compare with the parent drug that we have administered. So it is the finally the metabolites are excreted in urine. Next, adverse drug reactions are drowsiness, dizziness, anxiety, depression, diarrhea, nausea, vomitings, dry mouth, blurred vision, weight gain, and slow heart rate, nightmares. Next uses, it is indicated for the treatment of the hypertension, either alone or in the combination form. So this drug is used to treat the hypertension, means it is used to reduce the hypertension. It may be in the single dose or in combination form. Next dose, at first 10 or 12.5 mg once a day, and if the doctor has been suggested that we can able to increase the dose, that is 25 to 50 mg once a day. So next, beta adrenergic receptors antagonist or beta blockers. So what it will do means this drug is used in the treatment of the hypertension, arrhythmiasis, and ischemic heart diseases. So the beta blockers has been used in the treatment of the hypertension, ischemic heart diseases, and arrhythmiasis. So all the beta blockers or the synthetic agents completely inhibit the action of adrenergic agonist or beta receptors. So this drug will directly act upon the beta receptors, and it will block the beta receptors. So blockage of the beta receptors, it will lead to the reducing of the blood pressure by reducing the heart rate and cardiac output. Next drug is Timolol, and this is the structure of the Timolol. If you see here, IUPAC name 1, tret, butylamino, 3, 4, morphine, 1, 2, 5, thiodiazole, oxypropane. See here structure, this is the thiodiazole. Thia means sulfur, azole means nitrogen. Two nitrogen atoms are there. So it is diazole. So 1 in first position sulfur, second and fifth position nitrogen. So it is 1, 2, 5 thiodiazole. Here in the fourth position, the morphine is attached. The morphine. So morpholine is attached. Morpholine, the fourth position is attached to here. So it is a morpholine 4YL. Here in the first position, the tret butyl amino is attached. See here three butane structures. Three means three carbon atoms are there. Means three methyls are there. Tret butyl, and this is the amino. And 1, 2, 3. Three carbon atoms means propane. In second position, hydroxy group is there. So propane 2-ol. See here structure 1, 2, 3. Propane. In first position of the propane, tret butyl amine. 1, 2, 3. Tret butyl amine. And here in third position, the 1, 2, 5 thiodiazole. For this thiodiazole, in fourth position, morpholine structure is attached, and here the thiodiazole in the third position, the oxy group is attached. So next properties are, it is a white, odorless, crystalline powder, and slightly soluble in water, freely soluble in ethanol. And it is, if it is in the hemihydrate form, means it is sparingly soluble in chloroform. So pharmacokinetics, it is oral and ophthalmic route of administration, means it can be also applied on the eye. Ophthalmic means eye. So it is oral and ophthalmic route of administration, and it is metabolized in the liver by using the cytochrome enzyme. See here CYP2C19. It is a cytochrome enzyme, and it undergoes a first pass metabolism. Despite its relatively low first pass metabolism, the timolol is 90% metabolized. So it is 90% metabolized in the body. 4 metabolites of the timolol has been identified, with hydroxy metabolites being the most predominant, and its metabolites are excreted in the urine. Means it is the oral route of administration, oral and ophthalmic route of administration, and it undergoes the metabolism by first pass metabolism through using cytochrome enzyme, and this 90% of the drug is metabolized in the body, and it is eliminated through the urine. Adverse drug reactions are blurred vision, double vision, burning of the eyes, eye redness, watery eyes. Means because this drug is also used in the ophthalmic route, means for the eyes also we are using this drug. So we can also get the side effects of the eyes like blurred vision, double vision, burning sensation of the eyes, eye redness, watery eyes, headache, feeling of the drowsiness, nausea, insomnia means sleep problems, and weakness, ringing in the ears, dry mouth, diarrhea, loss of appetite, stomach pain, skin rashes, and cough. So uses, it is used in the treatment of the hypertension, glaucoma means eye related infections, and erythemiasis. So if we see the dose, the treatment of the hypertension is 10 mg through the oral route twice a day we can take, along with the diuretics. Means if drug can be taken in the single dosage form, or with the combination of the diuretics we can also take. The usual dose is 10 to 20 mg. Means usually we can take from 10 to 20 mg twice a day, but maximum dose we should take 60 mg per a day. That should be in the 2 doses. In the treatment of the glaucoma, means for the eye infection, that we should take the 1 drop of 0.25 solution in affected eye. Means which eye has been affected, that For the eye, we have to take in the form of the drops twice a day. Next, for the migraine, we have to take the 10 mg oral route of administration twice a day, and maximum we should take 10 to 30 mg per a day. So these are the drugs which comes under the antihypertensive agents. So these are the references books which has been means the topic is in this books, that is the antihypertensive agent.